Dr. Zaibak, we did talk about missing teeth, and you did mention that the mouth is connected to everything else in the body, all the way up to the head, headaches, down to the back, even shoulder pain, things like that. There's all kinds of things which could possibly happen if you have missing teeth. Now, what are some of the main ways of replacing a missing tooth, and did technology there make some really good improvements? I know there was bridges out there and stuff like that. Does that all still have a workability? Tell us a little bit about the 1, 2, or 3 ways of how to replace missing teeth, and why one would choose one over the other one. And just give us the big picture, since we really don't have all that much time.
Well, there's obviously there is implants, there is bridges, there is removable prosthesis, and each case is specific for each individual. Some people can't have they gag, so you can't put a removable prosthesis in their mouth like a denture or a partial, and you have to go ahead and give them either an implant or a bridge. Other patients don't have enough bone levels, and they're not a candidate for implants. So then you have no option but to give them either a bridge or a removable prosthesis. So each case is own specific, but there's obviously many ways to, many implant systems nowadays, many types of bridges, and that's what's the new to dentistry is there's a lot more options now that we can give our patients in the sense of material, products, and things like that will be suited more for their needs.
Well, so tell me, a person has one tooth missing, give me 1 or 2 examples, specific example when maybe an implant would be perhaps more fitting versus when a bridge would be maybe more fitting. Give me a couple of examples so that the viewers can see not just it depends, because we don't know what it depends on. Give us a few little reasons what it depends on.
Here's my philosophy on that. If a patient has a missing tooth and there's 2 teeth adjacent to it, meaning there's 2 teeth on each side of the missing space, the patient is a candidate for an implant or a bridge in my eyes. However, if the 2 teeth next to the empty missing space where there is no tooth are what we call virgin teeth, meaning they have no fillings on them, and they're completely healthy, and they're completely in good shape, then a better idea, I would choose more of an implant. If, however, the teeth next to the missing space both need some kind of filling or crown, then it's almost like hitting, 2 birds in 1 stone, and then you would do a bridge. Because if you just take care of the implant, those 2 teeth next to the missing space still need work, so might as well just take care of it with a bridge.
Got it. Because basically, if the teeth next to it are healthy, which would be used as a pillow, like on a bridge, that's why it's called a bridge, I guess. If they are healthy, then you want to, if possibly, avoid grinding them down to put that crown on it, because that would be like cutting into a healthy young little tree. My father used to tell me, when I grew up, I shouldn't carve in those trees because their skin it's hurting. They might even die. So is that kind of what it is? So if they're healthy, let them be. Don't grind them down. But if they already have problems, you need to fix them anyway. Then you might just as well cover it, with the bridge.
That's exactly the idea.
All right,
absolutely.
Now, is there data out there, be it your personal feeling data or be it long-term, research data, that a bridge or a implant, that one or the other holds longer, significantly longer, or is it relatively a toss? It could be pretty much the same.
There is data on both of them. There is some data that show an implant will last longer, and then there's data that shows why a bridge would last longer. I don't look at it like that. To me, they both, if the patient has good oral hygiene and they comes to the dentist every 6 months or every 3 months or 4 months, there is no reason really to worry about that. If the patient's a flosser and the occlusion is well maintained, then both of them can last equally.
Got it. Now, since you mentioned flossing and dental hygiene, let me give you a small example. When I walk with my wife in the evening into the bathroom, and she starts brushing her teeth, now I will have showered, shaved, brushed, and whatever else I might be doing, and she's still flossing and brushing. So the point is she does a lot more of it than I do. Now, would a person like me, meaning being a little bit maybe on the sloppy side, I know that when you have a bridge, it's like a welded piece together. You can't go with the floss in between. So flossing apparently is not impossible, but slightly more difficult. So would a person who is inclined to be a little more on the lazy side be maybe better off with an implant in that case? Because if he doesn't floss, gum disease will come about more easy when there is a bridge. Is there some truth to that or not?
No, because if you don't floss, you can also have an infection around the implant as well. As you know, the implant is butting against two real...
I'm not saying not flossing. I'm saying because flossing with a crown, with a bridge, is slightly more difficult because you have to kind of go underneath, and it's a little more complicated. So if now a person, because of that, doesn't do it, may he be getting more into the risk of losing that bridge because gum disease will develop.
Yes, absolutely.
Okay, I see. All right. But rather than that, if he basically does take care of it, there's no significant difference of the duration of how long it lasts. And what about the ability to bite and chew? Pretty much same also, the strength of the whole thing I'm talking about.
Pretty much the same. If the occlusion is correct and and everything is the bite is corrected, then that should not be an issue either.
Wonderful.
Both are fine.
Wonderful. Well, again, thank you very much for shedding light on it, because there's lots of people running around and they sometimes get told by a dentist that, implant is the new thing, and simply because it is the new thing and it is very good, what you're telling us here is it didn't, because of it, however, replace the crown and the bridge.
Absolutely. It's not, I wouldn't call it the new thing. It's an additional thing. It's an additional thing to dentistry that we as doctors can go ahead and utilize and give as an option to our patients. But it is not replacing one over another. They're both options. They're both used per specific case.
Got it. And I think that's a very good wording, additional. It's not new. It's not meant to replace the old one. It's here to fill a hole and avoid where the bridge didn't function, where it was possible, maybe too many teeth missing or whatever that's then basically it's a clinical matter, nothing much else really. It's like the dentist will say, look, this one or this one, they're both fine, or this one is good. If it's both fine, the patients may make the choice. Otherwise, actually, the dentist tells them and say, look, a crown, a bridge is just the way to go, or the other way is the way to go. And that's really all there is to it. Thank you.
Yes.